It was during my general surgery training in New York that I had my first exposure to plastic surgery. And on the first day of the rotation, I really decided I wanted to be a plastic surgeon. The case that we performed that day was a breast reconstruction case after a patient had a mastectomy from cancer. And I remember leaving that case and thinking, wow, this patient never has to wake up with a mastectomy deformity. She never has to wake up with that scar. She woke up with a breast that looked and felt like the other side. And I thought that that was so empowering that that's when I decided that that's what I wanted to do. I'm Dr. Ashley Gordon from Restore Austin Plastic Surgery Center. I'm the first board-certified female plastic surgeon who's also fellowship trained in aesthetic surgery to practice in Austin. Even as a child, I was obsessed with science, and during high school, I had the opportunity to work in our community hospital. I went to train in plastic surgery at Emory University. Dr. Reed trained there as well, and that's where we met. Emory is one of the best training programs for plastic surgery in the country, and we learned so much from them, not just the techniques, but the confidence and the judgment that I think is necessary to deliver a great aesthetic result. There are so many things that I love about being a plastic surgeon. It's just so much fun to do challenging, diverse cases every day. And while you're doing those cases, not only are you changing the way people look, but you're also changing the way they feel about themselves. Plastic surgery is constantly evolving and new technologies are introduced to us every month. You have to adapt and you have to change. About 10 years ago, I underwent breast augmentation, and it's one of the best decisions that I ever made for myself. I was so stressed and I had so much anxiety about choosing the right doctor and what implant was I going to use and what size was going to be perfect for me and how was it going to look when it was all said and done. And I think that I really bring that to every consultation. It's a huge responsibility that patients give me when allowing me to take care of them, and it truly is a privilege. The surgeries that I perform are purely elective, and so when someone decides to have surgery with me, it's because they've chosen me over everyone else, and I take that very seriously. I make a personal commitment to each and every patient to give them the best result possible in the safest environment.